Time to dive into our weekly Health Watch with Dr. Syed Hussain from Trinity Health in New England. Good to see you, sir.
Morning, thank you.
Glad to have you here. Of course, we're usually talking about communicable diseases, usually respiratory ones, flu, COVID. We'll get to those. But we have been seeing news reports about Ebola, maybe the scariest disease that we see popping up every now and then, usually in Africa. It has again, this time in Uganda. Doctor, what do we need to know?
Yeah, so there's been an outbreak that started last month, Tim. There are about 60 confirmed cases in some parts of Uganda, about 24 deaths so far. There are 4 strains that cause Ebola, which can lead to a whole gamut of symptoms. Starts with fever, abdominal pain, nausea, vomiting, but more ominously can go on to just a lot of internal bleeding, ear, nose, eyes, mouth, rectum, and leads to death. So it has a high fatality rate, up to 50%.
Very high, yes.
That's right. But this strain, we have not tested vaccines or any known treatments that work against it. So that's a little bit of a dicey situation for us, because the last outbreak, you may recall, we did have vaccines that were ultimately developed as well as treatment modalities. So what the U.S. is now doing, the CDC is on top of this. Any traveler from Uganda is being channeled or funneled into 5 ports of entry, 2 that are in the Northeast, including Newark and JFK, and those passengers are screened for any symptoms related to Ebola.
Right, and it's worth saying, you hear, wait, Ebola kills about half of the people it infects. Yes, that's something that COVID-19 has never even come within shouting distance of, but it is far less communicable than COVID-19 is too. So
that's right, absolutely. Yeah. So there's no reason to panic, but at the same time, we need to be prepared. One big lesson learned from the 2 current public health emergencies we're living under for COVID-19 and monkeypox is that we live in a very interconnected global village. And so if there is a case that comes in, we have the technical capability to treat those patients, but it's important that we screen and do our due diligence.
Okay, on to flu. Every week we're asking the same question. Have we seen numbers start to rise yet?
We have. So Texas and Georgia are now exhibiting high flu census per the CDC weekly tracker. And so we do expect flu cases to rise as the cold months up ahead settle in. There will be an increase in flu cases. So what you can do to protect yourself and your loved ones is to get the flu shot and take some basic public health measures to keep everyone safe.
Connecticut, though, we still haven't seen the rise yet. I mean, it's coming, obviously.
That's
but
right.
Hasn't really happened yet here in Connecticut. Back to how we're protecting ourselves once we get more indoors with the cold weather from both COVID and flu. Obviously, we saw the social distancing and the masking completely knocked the flu down. Is it going to work, though, if we're just doing it to protect ourselves on a case-by-case sort of basis now that it's not being widely done?
Yeah, and I do believe so. So the thing folks need to keep in mind as we approach the holiday season, Thanksgiving, and then Christmas, New Year's, is that this is going to be a year where everybody would want to come back together. And so one piece of advice I have for viewers is tailor your gatherings around the most highest risk member in your family or the gathering. So by that I mean anybody above the age of 60 who's immunocompromised, on immunosuppressant medications, has received a transplant, is on cancer therapy. Those folks you need to keep in mind. So make sure, for instance, all your attendees are up to date with their vaccinations. They've received the booster at least 2 weeks before the gathering. Try to ventilate the place as much as possible, even if it means investing in some heat lamps, for instance, for an outdoor gathering. If not, crack the windows so there's some ventilation going through.
And which should help, because if you get a lot of people together, you generate a little bit of heat. Those rooms can heat up.
That's right. And one other thing to keep in mind is do a rapid test just before the gathering to ensure that everybody's negative.
Smart. Yeah, there you go. That's what we're going to be talking about a lot here. We do this every Wednesday morning, and we'll be doing it in the coming weeks, especially as we get closer to Thanksgiving, which is happening maybe a little earlier this year. So maybe it's not going to be quite as cold, but we'll see. Doctor, thank you so much.
Thank you.
Good to see you again. Dr. Syed Hussain.